It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Welcome to this edition of the Best Docs Network in Houston, where we show some of the best doctors in the Houston area that are changing people's lives. I'm Dr. Nina, along with Jim Knox.
That's right. This is the place to come to find the right doctor. It's also a show about doctors referred by other doctors. And Dr. Nina in the Houston area, of course, this is the time of season for what? Allergies. Well, we have the best doctor for you. It's Dr. Lynn Dickens.
I think there's a lot of confusion now about exactly what an allergist is, because a lot of people do allergy testing that are not board certified in allergy and immunology. So what we see actually in this practice is not always allergy, but people come to us because they think that it might be allergy.
According to Dr. Dickens, allergies really come down to having a problem with the immune system.
Allergy is really just an abnormal response of the immune system that some people have, and they react to things in the environment that really aren't harmful. But if you happen to have an abnormal antibody called an IgE antibody, then you start to react to things and the response actually harms you more than it harms that ragweed pollen.
Many know living in Houston can cause allergy problems. The reason?
I would say because we're very humid and moist and warm, we see a lot of mold problems here, and people can develop not only allergies, but they can develop a chronic allergic reaction to that in their nose and wind up having polyps and then develop asthma, those kind of problems. So we see a lot of mold because it's always either heavy or extremely heavy. Dust mites because the environment is again very moist and warm, and they can get down in the carpet and into your homes.
When it comes to helping people with allergies, Dr. Dickens' Allergy Clinic does it in a unique and special way.
We try to have the nice art in the office, that they feel very comfortable when they're here, that it's not sterile, that the staff knows them well over the years, and we try to spend a lot of time knowing their particular story and how they would respond best. So I really think it takes a village in a way, and I have a very nice village here. Wonderful staff, very well trained to be able to recognize different kinds of allergic emergencies and treat them quickly and call the doctor when necessary, and really just make the patients feel very secure. That's what we try to do.
I took on the role as Bariatric Medical Director here at Maislos Willowbrook in January of this year. What I wanted to bring together was a comprehensive team of interested specialists. We put together a group of individuals who are very much interested in weight loss, both medical and surgical, and we're centered around the patient.
It's a patient-centered approach, and the patient's at the hub, and then the spokes that come out from it are the surgeon, the psychology of weight loss and how that affects them, what may have caused them to gain weight and to get into this predicament where they suffer from morbid obesity. And then the dietitian, the registered dietitians that we have here as another aspect or another spoke around the hub of the patient.
The reason why we gain weight is a multifaceted problem. Really, there's no one approach that's going to solve this issue. Some of it's genetic, some of it's environmental, some of it's cultural, and so we have to look at it that way. At Maislos Willowbrook, we do 3 of the procedures for weight loss. We do a Roux-en-Y small pouch gastric bypass procedure, we do a laparoscopic gastric sleeve procedure, and we do the lap band.
We have weight loss surgery seminars at Methodist Willowbrook Hospital. At those seminars, I think patients really get to hear some of the finer points of the surgery about what we do and why we do it. Just to have that satisfaction of knowing that someone's diabetes is resolved or their blood pressure is no longer requiring medications to control, their cholesterol is better, they no longer have sleep apnea and they're finished using their CPAP machine. And then as a nice byproduct, from a cosmetic standpoint, the patients look better, then they also develop more confidence and they feel better. And so we're all about making patients healthier, but we do also have some of the other added benefits of patients feeling better about themselves and how they look.
The surgery, almost anybody can do this surgery. It's the whole package. We think that's important, and I think that's really what sets us apart from the average institution.
Aaron's a gentleman in his 30s who'd had several years of spinal pain coming from his neck. So he had pain in his neck radiating to his shoulders and upper extremities. And at that point, we had diagnosed him as having degenerative disc disease in the cervical spine at 2 levels.
Imagine walking around through your day in your head never being in a place of rest, and you're constantly hurting. And then you think, okay, it's bedtime. I didn't look forward to laying down and going to bed because it still hurt.
So he underwent physical therapy, he underwent some injections and just the passage of time and taking medications, and over the course of 2 to 3 years he decided that his symptoms had become severe enough and were no longer responding to what we call non-operative treatment.
Never during that time did he ever say, you need surgery right now. You need it right. If you want to be fixed, you need surgery. You need to go have surgery. Never did that. Those kind of things, not pressuring me, letting my body talk to me, let me know when I was ready. It let me know that he cared.
We offered him fusion of the cervical spine at 2 levels. So fusion means, for example, in this model, that this bone is fused to this bone, and that's called the fusion. So there's no motion here. And hopefully what that does is it eliminates the pain.
The first time I actually laid down without pain, I was excited. I was super excited. I couldn't believe it. Because I could never find a point of rest before that. So that's when I was really, really happy about it, and I knew that it worked.
That's one of the more satisfying things about doing what I do, is to hear the positive stories of how the surgical treatment positively impacted the lives of various people. And yes, we do hear the comment quite often that, I don't know why I waited this long to get this fixed.
He said, just don't put anything on your head or carry anything on your head. He said, help me with that. He said, just use common sense. And he said, you can resume your everyday activities. The very next day I was golfing. I just appreciated that, him taking his time. And the end result was just perfect, and it was great. I feel awesome.
There is nothing good about a sunburn. Not only does it hurt, but it can make your skin leathery, thick. It can increase the number, the size, and the depth of wrinkles, and it can cause skin cancer. That's really bad. You need to use a sunscreen when you're out in the sun for prolonged periods. SPF 30 is about the ideal number. A lot of people use an SPF 40, 50, 60, and 80, but you really don't get much bang for your buck after SPF 30. So just get your SPF 30 going, apply it every couple of hours while you're out in the sun, especially if you're in and out of the water. Make sure your kids have the SPF 30 sunscreen on regularly also. People with red hair, blue eyes, and freckly skin have a much greater incidence of skin damage from the sun. Also, if you're on certain antibiotics for urinary infections or respiratory infections, that can sensitize you to the sun, and you can get a sunburn far more quickly and far more deadly than you normally would. So protect your skin. The sun's your friend, but it can also be your enemy.
Kimberly was born premature, so we had quite a bit of time in the hospital, about 6 weeks after birth. And it was about 2 weeks into that there was some discoloration to her left cheek and her lower lip. And that later started to grow, and we found that it was hemangioma.
Kimberly was born with a congenital hemangioma, which is a blood vessel tumor. It involved the skin of her face, and it also involved deep structures as well.
Coming to Dr. Eisman and him explaining that it would be a process, but there would be a time that we really wouldn't be able to look at her and know the starting point with regards to the growth.
You know, we basically like to tell them in advance what we're planning on doing, and in her case, it's a staged procedure, and it was planned just that way. If you're trying to do too much at one time, you know, it can even be dangerous as far as the bleeding is concerned. So we tell them in the beginning that we're doing as much as we can at that time, and we probably removed maybe 20 to 30% of it, probably the first operation, and she's had 5 or 6 operations since.
I was excited because after all of this, I actually look like this. At first it was a lot, like all around my face, but it was, now that I look back at it, I'm actually really excited or happy.
There have been times that she came in after surgery that from the point of entry, we would hear, Kimberly's here, Kimberly's here, Kimberly's here. And people would come out, you know, and just, hi Kimberly, how are you Kimberly? And that means so much, and especially for an 8 or 9-year-old who's bandaged from surgery, you know, it just goes without saying that his office staff is so supportive and so caring.
It makes me feel nice that he cares, or that he has, like, that he is nice enough to ask me how am I doing, or how is life going for me now.
Well, it's changed her life, you know. I can't imagine her going on life the way she was before without having had surgery. I don't think she can either.
I would say that people don't stare at me or talk about me or anything like that. They treat me nicely, and now I just feel really excited or happy to see that I can do all these things confidently because of Dr. Eisman.
Okay, now for more information on some of these amazing doctors you've seen on our show today, or to watch more life-changing stories, please visit our website, bestdocsnetwork.com. That's bestdocsnetwork.com.
All right, we have some help for a lot of people who are suffering from sleep disorders. We have the doctor just for you. It's Dr. James Ludwig.
Jill came to see me for hearing loss. And then while she was here, she was also talking about, she told me she had some allergy problems, and then also the snoring, and it was feeling like she had insomnia, and she couldn't stay asleep during the night. She was tired during the day, wake up with a dry mouth.
I think you have sleep apnea. I'm going, what's sleep apnea? He said, well, sleep apnea is where you don't get any REM sleep and you don't sleep well. Are you tired a lot? I said, I've always been tired.
We obtained the sleep study and found out that she had, you know, a lot of sleep fragmentation from snoring and from sleep apnea.
He said, well, we'd like to do the second test, of course. We diagnosed the fact that you do have a sleep apnea. So went in another night, electrodes, but I had a mask this time. And I fell asleep. I woke up the next morning. It was like, wow! I mean, geez, it was like, I am so rested. So he didn't have to do a hard sell or anything with me. I mean, he said, you need a BiPAP machine. We've decided that, and this is why, and he sat down and explained everything to me.
If you have the other effective treatment option, and you decide to have surgery, and there's something that I think that we're gonna do that has a good chance of making you better, then let's do it. But for some people, that's just not their best interest, you know, and she's happy. You know, Jill sleeps every night, has no complaints, she loves it, it's safe, it's effective, guaranteed to work. Are we going to beat that with a surgery? No, we're not.
My coworkers at the time noticed an immediate difference between, I mean, I didn't tell them what was going on, but they noticed an immediate difference in my demeanor and my approachability.
If that therapy makes you feel great, I just think that your opinion of that therapy is going to change, right? Now, if you can't use it, you know, you're claustrophobic, you have an obvious anatomic problem, and sure, let's go down this other path and we'll make you better. But better and perfect aren't the same, you know?
It's made a great impact. It's really, the only thing I miss, and this is going to sound crazy, but I'm used to having 22 hours in the day as opposed to 16 or 17, you know? And I can't get as much done as I used to get done because I'm sleeping. But the trade-off is great.
I was diagnosed with fibromyalgia 5 years ago, and and I was experiencing chronic pain, exhaustion that wouldn't go away. I actually met Dr. Beck through his wife. Somehow the conversation that I had fibromyalgia came up, and she said, my husband is doing a new study. It's called a P-stem. And I was like, and she explained that it was for chronic pain, arthritis, fibromyalgia. It was FDA approved.
What is nice about P-stem for patients is that there is very little prerequisites required to place this on. Outside of the contraindications of pregnancy or pacemaker, any candidate can benefit from P-stem.
He installed it right there, and there was no drugs. I drove myself there, I drove myself home. Within 4 minutes of him putting it on, my headache started decreasing and my pain started to ease up. And by that evening, I just felt great. And somebody said, you just look happy. And I was like, well, I'm not suffering from that chronic fatigue and that chronic pain.
There is a lot of skepticism initially with using P-stem, but I've read the articles, I read the journals, I spoke to patients, and I came to realize that this actually will be beneficial to patients. So I took the initiative to talk to the distributor and made plans to be trained in the use, and that's how I became the first physician in Dallas to be licensed to use this device.
And my husband's gotten his wife back. My children have gotten their mom back. I don't complain. I'm happy. I feel great. And I'm really excited about it.
What I find rewarding about P-stem is that I can finally offer patients a non-pharmacologic way to help patients manage their chronic pain.
I had the gastric sleeve. It's where they go in and they remove about 2/3 of your stomach, and it didn't involve any rerouting of the intestines, which is what I really liked about it, so I didn't have malabsorption problems. Went in one day, did it, stayed that night, went home the next day.
The difference with the sleeve compared to the gastric bypass is that there's no malabsorptive component to the surgery. So it avoids some of the long-term issues that can happen with the gastric bypass. In particular, there are very few vitamin and mineral deficiencies later because everything goes down the normal way. A lot of patients feel comfortable with it. They know that there's not something that probably may have to be taken out later on. The weight loss is very good. It's comparable in our patients to a gastric bypass, probably within 5% to 10% weight loss compared to the gastric bypass, which is the gold standard.
Last month we went on vacation. We were gone for 12 days up to the East Coast area. We walked through the Arlington National Cemetery, which I wouldn't have been able to do a year ago.
The operation, we like to say, is not an end in itself. It doesn't take care of everything. It won't lose weight completely on its own. But what the operation does do is it gives the patient a lot more control than they have before the operation. If you do the things that you've been trying to do to lose weight, if you exercise fairly regularly and consistently, even if it's not a lot, you will lose a lot of weight. If you eat right, if you decrease the percentage of carbohydrates and fats in your diet and increase the percentage of proteins and limit the total number of calories, you will lose a lot of weight. It makes the good behavior a lot more successful than it was before the surgery.
First of all, it's a tool. It's not a fix. Dr. Marvin and his staff will get you there. They will walk you through it. Make sure that you are taken care of, that your needs are met too. And that's what's so great about Dr. Marvin and his staff. It has made a tremendous difference in my life.
We hear when you're a kid in school and all talking about having good hygiene and keeping your body clean and this sort of thing. It is very important. Most people don't realize that there are a lot of very dangerous microorganisms out there. There are things like staph, there are viruses, or all sorts of things. We hear stuff on the news about the avian flu and all these sort of things. And if you don't use good hygiene, you don't keep your hands clean, if you take your hands, touch your nose, your eyes, your mouth, those are ways that you can transmit diseases to your body. And there are some organisms out there that just by being in certain situations you can be exposed to, like this very dangerous methicillin-resistant Staph aureus, the MRSA that a lot of people have heard of. That can really be a very dangerous bacterium. And we're finding more and more of these cases are acquired in the community. Years ago they were only in the hospital, but now we see a lot of people just getting them just in general. So there are a lot of things like that that can cause problems that people don't understand where you can actually acquire one of these infections. For that reason, it's very important that people do keep their skin clean, that they do wash their hands relatively frequently or use one of the hand cleansers, and especially if they are a carrier of something like staph, to use some kind of measure to keep their body from developing a boil or one of these more dangerous infections. And so as a consequence, after you've been in that environment, you really ought to use some kind of a measure to sort of sterilize your skin, so to speak, and make sure that you take either a shower or wash your hands or something at the very least to make sure that you're not going to actually be colonized with one of these organisms that can lead to a more serious problem. One of the ways that we're kind of excited about is that we've developed this new bleach-containing wash. Bleach is very strong antiseptic product. It actually kills just about any bacterium, kills a lot of other things like viruses and even fungi. And if you use something like this, it will cleanse your body quite well, and if you use it on a periodic basis, you can maintain your body from actually getting colonized and keep it sterile or keep it cleaner for a longer period of time. So we recommend using something like that or one of the antibacterial soaps or something to keep your skin from getting one of these serious infections.
Kimberly was born with a facial birth defect until she met Dr. Michael Eisman. Now she's a beautiful young girl. To find out more on Kimberly's story and other life-changing stories, log on to bestdocsnetwork.com.
Here at Revella Plastic Surgery, we perform plastic and reconstructive surgery. We emphasize aesthetic procedures primarily of the breast, body, and face. The ideal candidate for a breast lift would be a woman who's completed their childbearing, their breast changed during pregnancy or during lactation, and they have perhaps stretch marks, excess skin, and they've lost a lot of the fullness in their upper part of their breast. So typically they're going to want everything lifted as if what a bra can do for them, and that may involve an implant or without an implant.
After birthing 3 children, I needed some help, so I came and saw Dr. Revella. I knew some people in the area that have had his work done, or had work done by him, and so I was pleased and came to see him as well.
Amy came to us with sagging breast and after children. She wanted them uplifted. She wanted to be able to wear certain tops and clothing that looked perky without being saggy, and having to wear special undergarments that were cumbersome or bulky. So what we performed was uplift with implants, and she's turned out very nicely, and she's happy with the results.
I had friends that after I had it done looked like I had lost 10 to 15 pounds, and I had done nothing different with my eating or anything. It was just the way that the top of me was carried before versus after.
It's a fairly quick recovery after a breast lift, and it takes maybe about a month to 6 weeks to get back on your feet feeling like like you did before.
The entire office staff is wonderful. They are all very helpful. He's super nice. He is very informative, very helpful. We'll take your calls if you need to ask him any questions. He is there if he can't answer them. His nurses are there and available to you, but he is great as far as explaining everything and being there when you come out of your procedure to make sure you're okay. Yes, I would recommend Dr. Revella. He is wonderful as far as his help and the courteousness of his staff, and his results are fantastic.
My symptoms are, I don't want to walk on the ball of my foot. It shoots sharp pains up my leg. I mean, it feels like a nerve's being pinched off.
Wanda's a patient that presented to my office complaining of shooting pain, down her heel, upper leg, and so immediately I started thinking maybe there's a possibility of a nerve, compression.
Told him my symptoms, He suspected what it was. He wheeled in a little mini ultrasound machine, did it right there on the spot, and diagnosed the problem. And we set up surgery because I had already tried other treatments with other doctors and it didn't work, and we were done.
This is your ankle joint, and you have a major nerve that courses through here. There's a natural tunnel. It's called your tarsal tunnel. What happens is the tunnels get real tight and they clamp on the nerve, are the protective covering, which we call the flexor retinaculum. The nerve tends to get stuck underneath it. So what happens is when the nerve gets compressed, it's extremely painful.
What he's trying to do is avoid that numbness, and for most people it works. You basically take what's pinching the nerve off away, and you make room for it, and life goes on.
And the advantage of this is it's not a surgery where you're really held up for a while, where you have to, stay at home and you can't put weight, because I want the patient walking as soon as they can, because I don't want those tunnels to tighten up or to close up. So I want to make sure the nerves can glide. Wanda had tarsal tunnel surgery. She comes back to the office 3 to 5 days later, and just dressing change. No need for x-rays because we're not doing any bone work, which is great too, because if you're not doing bone work, it's not necessarily as painful. There's less swelling. And so 2 weeks later, sutures are out and she's walking on her own.
I'm very happy. I've actually recommended him in all my friends that have gone to him, and they've had more extensive things done to them where, you're reattaching muscles and putting in screws, really crazy stuff. They also think he's awesome.
The side effect that one has from nerve decompression is not pain, it's lack of sensation, it's numbness. And that's temporary because with time they regain their sensation, but it's a really easy recovery and it provides immediate relief.
My son is 7 years old and he has really severe eczema, and because of that he has battled with bad staph infections over the years.
His eczema became more severe over time, and it became what we call lichenified or thick, and so we were having difficulty controlling the atopic dermatitis, and secondarily he was developing skin infections on top of the atopic dermatitis.
And about 8 months ago he developed a really bad staph infection, and usually we can kind of keep it under control by doing bleach baths or just finally getting an antibiotic for it. So we had made an appointment with Dr. Ghali, his dermatologist, to go ahead and get an antibiotic. And when we went to see him, he said, before we do this, let me introduce you to this new product and have you try it out first before we have to do the antibiotics.
Beginning in May, we started to implement Seal-In Body Wash, which was a product that we were currently studying in atopic patients who had recurrent skin infections.
Actually, after a week of using it, I noticed his skin kind of was showing some improvements. It started clearing up. And then by the time we went and saw him 2 weeks later for our follow-up visit, Andon's skin was almost all the way clear. So we continued to use it, and now we use it about once a week just as a precaution. He can use the product himself. I don't kind of have to measure the bleach out, stuff like that. He just kind of does it in the shower. It lathers up like a soap. We can travel with it. We've taken a few vacations. We just throw it in the suitcase with everything else.
He went from a very severe patient to more of a mild to moderate patient. And in the realm of atopic dermatitis, that is a huge improvement. And what it means to the family is that this child can sleep better. It also means to this family that the dynamics change in the house. Parents can often get the rest that they well deserve, and the kids can function in school a lot better.
His skin just continues to get clearer and clearer, and so far in the last 8 months he has not had another breakout, and his skin looks the best it's ever looked.
All right, that'll do it. That'll wrap up another edition of Best Docs Network, the show that features some of the best doctors in the Houston area that, of course, help change people's lives. And for more life-changing stories, just like you've seen on today's program, head to the website. It's bestdocsnetwork.com.
And if you have a comment or maybe a question for one of our doctors, we love receiving your emails. So send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.